So I decided to produce this little video just to explain a little bit what is going on in Brazil, because we need to have the good numbers to understand exactly what the situation is in our country. Okay, so regarding the cases, we have a big issue with cases all over the world. Countries that test a lot have a lot more cases and a totally different mortality rate. So instead of counting the cases, it's a lot more important to count dead people regarding the population. How many people die with 1 million inhabitants per country? So what are the numbers today, June the 1st? United States, 320 dead people for 1 million inhabitants. Brazil, 136. That's more than 2 times less. What's going on in Spain, UK, and Italy? It's 4 times more dead people per million inhabitants. 580 in Spain, 567 in UK, 553 in Italy. And in France, 441, 3 times more. So Spain, UK, and Italy, we have 4 times more dead people than what per million inhabitants than what we have in Brazil. And in France, 3 times more dead people for 1 million inhabitants. That's very important because it gives us an idea of how serious the situation is in each country. Of course, that might change with time, because if European countries are on the slope going down, probably that will not change, or very, very, very little. Eventually in Brazil, if we're on the rise, it will change. Last week, 7 days ago, we had 95 deaths for 1 million inhabitants. Now we have 136. We might have 180 or 200 next week. We don't know. Time will tell, and I will produce another video to give you an idea of what's going on. But for now, that's the situation. We're far away from Europe, fortunately. Now, regarding a very second aspect, extremely important for COVID. How are intensive care unit beds capacity in São Paulo? Well, let's look at the Einstein. And the Einstein is almost the same situation that we have in the Einstein is going on with all the private hospitals. At the Einstein, only 28% of intensive care unit beds are occupied with COVID. 42 beds out of 150. That means that 72% of intensive care unit beds at the Einstein are empty. That's a very, very good news. That means that if you need care, you will get it. And you will get the best care. So that's very nice. Now what's going on for people who cannot afford to have a private hospital? Is it that bad? Well, not that much. Look at this. I checked the numbers for the city of São Paulo. And São Paulo, of course, is like New York. It's the hot spot in Brazil. This is where we have more cases. How are the hospitals here? Well, I checked from May 20th to May 31, and you'll see what goes on. Till the 27th, we had more or less 90% of intensive care unit beds occupied. On the 28th, 83%. On the 29th, 80%. On the 30th, 79%. And on the 31st, 83%. So that's good news. It's going down. Of course, we will need to watch what goes on for the next few days, but we're not facing the situation they had in Italy, where they had to choose who goes on the ventilator or not. That's a very nice thing. So these are the numbers, and this is what is really important regarding COVID. Of course, the amount of cases is also important, because if you get COVID, it might be serious. A last thing, which is last but not least, as we usually say, is the mask. Look at the mask, because I'm going to put it on. It's very important to wear a mask all the times we leave our houses. First, make sure your hands are clean. Of course, you're home, your hands are clean, it's fine. When you put on the mask, it can be a cloth mask, okay, 2 layers of cotton, and pay attention that you have to breathe through the mask. Look at this. You have to have a mask that is very well adapted here, close to the nose. It has to be very close. Because otherwise, when you're breathing, I've seen patients with cloth masks like this. That doesn't help because the air comes through here. The air has to come through the cloth. That's very important. And every time you want to touch your mask to adjust it, please, you have to have the mask, not the mask, the alcohol, I'm sorry, in your pocket or in your purse. You wash your hands, and once you've washed your hands, then you adjust the mask. Because as we talk, the mask sometimes is not as adjusted as we would like. So that's the message. And next week, in 7 days from now, I'll produce a second video to show you the situation in Brazil and analyze the numbers with Public Health Service and the Einstein again to make you and help you, better than make you, help you understand what's going on in the real world. Thank you.